Have you ever found yourself wondering, why does penetration hurt? Perhaps you've experienced pain during sex, while inserting a tampon, or during a gynaecological examination. Maybe you've been told that pain is normal, that you simply need to relax, or that it's all in your head. Or perhaps you've started avoiding intimacy altogether because the fear of pain has become overwhelming. If that's your experience, I want you to know something important. Sex is not meant to be painful. Pain-free, pleasurable sexual intimacy is something that you are worthy of and is a very real possibility for you. Hello and welcome to Ask a Sex Therapist, a space where we explore sexuality, intimacy, relationships, and sexual well-being with curiosity, compassion, and evidence-based understanding. I'm Justine Gilliland, a sex therapist and counselor, and in today's episode, we're exploring the question, why does penetration hurt? Experiencing unwanted pain during sexual activity is a serious concern and should not be treated as normal or something to simply grin and bear. Painful sex is common, occurring at least occasionally for a majority of women. While occasional discomfort may occur, unwanted pain, especially recurring pain, is not something to tolerate. Experiencing pain during sexual intimacy can be significantly difficult and distressing. You are not alone and you are not broken. In this episode, I'll explain what painful sex is, clarify the differences between vaginismus, dyspareunia, and vulvodynia, explore common causes, address common myths, and discuss how sex therapy and medical support can support satisfying sexual intimacy. So, what is painful sex? Dyspareunia is a general term for painful intercourse. Pain may occur before, during, or after sexual intercourse. The pain may be experienced on the vulva, at the opening of the vagina, or deep within the vagina or pelvis. Pain can be experienced as burning, stretching, tearing, stinging, pressure, or itching. Vaginismus is the involuntary spasm and tightening of the pelvic floor muscles which obstructs vaginal penetration. Penetration becomes impossible or extremely difficult. This can include penetration by a finger, tampon, penis, or even during a gynecological examination. Vaginismus is often driven by a panic response in the body linked to fear and anxiety surrounding penetration. This involuntary, conditioned response can stem from negative sexual conditioning, sexual trauma, and other painful past experiences. However, this is not always the case for vaginismus. Vulvodynia refers to discomfort or burning pain specific to the vulva without explanation, such as skin condition or neurological disorders. When pain is constant and unprovoked, it may be referred to as dysesthetic vulvodynia. When pain occurs specifically around the vaginal entrance when pressure is applied, this is known as provoked vestibulodynia. These conditions are grouped together in the DSM-5 under the diagnosis of genitopelvic pain penetration disorder. What are the common causes of painful sex? Painful sex is influenced by a combination of biological, psychological, relational, and emotional factors. Biological factors. This can include hormonal changes such as reduced estrogen levels in menopause, which can decrease lubrication, thin vaginal tissue, and reduce elasticity, leading to pain during intercourse. There may be sexually transmitted infections such as herpes, yeast infections, pelvic inflammatory disease, and other infections that contribute to pain. Tightness within the pelvic floor muscles is a common contributor to genital pain. Other conditions such as endometriosis can cause deep pelvic pain. Pain may also develop following surgery or other medical procedures. There are also psychological factors. This can include fear and anticipatory anxiety that activates the body's threat system, causing the pelvic floor muscles to tighten. Past sexual trauma, frightening sexual experiences, negative sexual conditioning, and rigid beliefs about sex can all contribute to pain. Sometimes the body learns to anticipate danger even when the person consciously wants intimacy. There are also relational and emotional factors. A lack of communication about sexual needs, pleasure, and comfort can perpetuate pain. Pressure for intercourse, misunderstanding from a partner, avoidance, shame, and emotional disconnection can all contribute to ongoing distress. Many individuals begin to feel broken or defective, which only amplifies the emotional burden of the pain. Common myths about painful sex. Number 1, pain is normal and should be expected. Many people tolerate pain unnecessarily and even push through it because they believe it is normal. This belief only delays support and treatment and can even amplify the pain and contribute to more and more sexual avoidance. Pain during sex can be treated and managed. Sex can be pleasurable, and unwanted pain should not be tolerated. Myth number 2. If my doctor finds nothing wrong, the pain must be all in my head. Your pain is real. If a biological explanation is not immediately found, it simply means the source of the pain is not yet fully understood. Psychological and relational factors may contribute significantly to pain, but that does not make the pain imaginary. While there can be psychological and relational factors that are the root cause of the pain is still felt in the body. And your body reacts in a real, tangible way to that pain. So even when pain stems from a psychological or relational cause, the body also must be treated. Myth number 3. I just need to relax and push through the pain. Forcing penetration can reinforce the association between penetration and pain, worsening symptoms over time. Relaxation exercises are certainly valuable and they are a useful skill to know how to practice. However, it is important that this comes from a place of understanding and partner support. So here are some practical steps or mindset shifts that you can incorporate now. It is essential to prioritize lubrication. Consider using a water-based lubricant and incorporating it into sexual play even before penetration. Expand your definition of sexual intimacy beyond the go-to script of sex equaling penetration. Sex is more than penetration. Explore cuddling, kissing, sensual touch, manual stimulation, oral sex, or even vibrator stimulation. Allow these experiences to stand on their own as meaningful and fulfilling forms of intimacy without pressure for intercourse. If you are the individual experiencing sexual pain, take charge of penetration at your own pace. If penetration is something you desire, you are the one that needs to guide the process, including the speed, depth, position, and pacing. This can help you increase comfort and create a greater sense of safety and control. Communication is essential. Communication needs to be proactive. Talk openly about pleasure, desire, fears, anxieties, and pain. Work together as a sexual team to create experiences that feel safe, pleasurable, and connected. When is it important to seek professional support? It is essential to seek support if pain is persistent and not relieved by simple measures such as lubrication. If pain is causing significant distress or sexual avoidance, if penetration is impossible or extremely difficult, if there is relationship strain resulting from the pain, if fear and anxiety around sexual intimacy continue to increase. Due to the complex relationship between biological, psychological, and relational factors, sexual pain is best approached holistically. Consult your GP as a first step to investigate possible biological contributors. And here is a massive shout out to pelvic floor physiotherapists. Pelvic floor physiotherapy is considered an essential treatment for many forms of sexual pain and addresses the physical and muscular components directly. This, alongside sex therapy and a holistic approach, enhances your opportunity to experience fulfilling and sexual pleasure when it comes to intimacy and penetration. Sex therapy addresses the psychological and relational factors that contribute to and maintain pain. Sex therapy helps because it is part of an integrated, multidisciplinary approach to treating sexual pain. It can help you understand fear and anxiety, challenge catastrophic thinking, reframe negative sexual beliefs, establish realistic goals, and validate both the psychological and physical experience of pain. In therapy, I invite couples to explore the pain together as a team. We work on fostering empathy, understanding, communication, and connection. We explore sexual expectations, relationship dynamics, sensuality, pleasure, and practical ways to nurture intimacy despite the challenges pain may create. Painful sex is not something that should be ignored or endured. With the right support, compassion, and guidance, it is possible to heal, reclaim safety in your body, and experience intimacy that feels connected and pleasurable again. Thank you for listening to Ask a Sex Therapist. This podcast is a space where I'll be exploring common questions and themes that arise in my work around sexuality, intimacy, relationships, and sexual well-being. Topics that many people quietly struggle with, but rarely talk about openly. If you'd like to learn more, explore related blogs, or inquire about online sex therapy across Australia, you can visit my website at wellbeingcounsellor.com.au. You can also subscribe for future conversations about sexuality, intimacy, relationships, and emotional well-being.